In your morning medical news, it's been deemed a significant public health issue. The U.S. Surgeon General says parents are overwhelmed and burned out with the dizzying pace of the world. And while it's calling for shifts in policy and cultural norms, mental health experts say there are also ways to navigate all those feelings. Mandy Gaither has some tips.
Being a parent isn't always easy.
No.
Finally, this is a topic that's receiving the attention that it deserves and is long overdue.
Psychologist Adam Borland with Cleveland Clinic says parents today are navigating stressors that they didn't grow up with, including things like social media, 24-hour news cycles, internet safety, school safety, the COVID-19 pandemic. It can all feel a little overwhelming.
I think it comes down to a sense of acceptance, the fact that I am feeling this way. It's not a weakness. It's the reality of the situation that I find myself in.
Borland says parents can cope by prioritizing teamwork. That includes asking and receiving help from a spouse, family member, or the community. And focusing on gratitude can help remind you of the good things in life and your wins as a parent.
It's very easy to negatively compare yourself to others without recognizing, I'm doing a really good job here.
Borland says to also find a healthy balance between things at home and other stressors that exist outside of it. Part of that also includes making time for yourself. He says self-care is not selfish.
It's the idea of carving out that time and recognizing that I'm going to be a better parent, I'm going to be a better partner, I'm going to be a better family member by attending to my self-care.
Borland also says it is also important to remember mental health treatment is always an option. He says seeking help for yourself isn't a weakness, it's a strength to ask for and receive help. If you need a couple of cups of coffee to get going in the morning, a new study shows that habit might be good for your heart. A new study finds 1 to 3 daily cups may prevent serious health issues. Researchers looked at 360,000 people's habits. Moderate caffeine intake could cut the risk of multiple heart and metabolism problems by 48%, they found. But don't celebrate with an extra latte quite yet. The study is observational, so other factors could explain the benefits. In your morning medical news, drowning is the #1 cause of death for children with autism. It's why swimming lessons can be so crucial. CBS's Christian Benavides introduces us to a family making sure their child receives this critical instruction.
Parents Jana and Russell D'Agostino worry about their 3-year-old daughter Daniela. Like other kids with autism, she's drawn to bodies of water.
We knew having her learn to swim was critical because I don't know if she's going to jump the pool fence or, God forbid, she gets in and no one's outside, or even worse, gets to the lake.
The D'Agostinos live in Florida, where pools, lakes, and beaches are accessible all year long.
My only hesitation was just if she was going to listen or not.
They enrolled her in swimming lessons that focus on survival skills in the water. Erin Cates is an instructor with the Baby Otter Swim School.
She falls in. She's going to know exactly what to do. She's going to turn around, she's going to turn, kick, and reach, and she's going to get up to that wall, and she's going to hold and wait for us.
The Autism Society of Florida says drowning is the leading cause of death for children on the autism spectrum.
The drowning rate for kids with autism is 160 times greater than other children.
It's in part due to autism alone, when children run or wander away from caregivers. Most drownings occur in backyard swimming pools, and nearly 1 in 3 parents of a child with autism reports they've had close calls. Mindy York is president of the Baby Otter Swim School.
This is as important as a car seat, and make it a priority.
Kick and reach.
Critical lessons that are saving lives.
So important. The Autism Society says 91% of deaths in children with autism 14 or younger are due to drowning. A startling new forecast on the potential impact of the ongoing superbug crisis is prompting the World Health Organization to call it a top public health threat. Researchers blame antibiotic misuse and overuse for creating these drug-resistant infections. Deaths among adults 70 and older surged 80% between 1990 and 2021. Experts urge better care, stronger drugs, and more resources to combat the growing crisis.